Direct nationwide epidemiological studies are needed to understand the variation in progress towards the SDGs, including in some key populations such as by sex, among indigenous or tribal populations, or in, let's say, rural or urban areas. For example, mortality and the cause of death statistics captured in the Million Death Study from India are an appropriate way to monitor the SDG progress in that country. The MDS in India confirms that from 2005, child mortality rates have accelerated in their decline. As a result, 1 million fewer children died than would have at the earlier rates of progress. With continued focus on priority conditions, India could save even more children's lives. Importantly, the MDS showed that the conditions that were prioritized in the national health missions had the greatest declines. So, for example, pneumonia and diarrhea fell by over 60% between 2000 and 2015 due to effective treatment. In that time period, measles and tetanus fell by 90%, mostly due to special immunization campaigns that targeted these diseases. By contrast, malaria mortality among children did not fall nearly as fast as they did for these other conditions. This reflects a relative neglect of childhood malaria prevention and treatment. In addition, death rates from low birth weight and prematurity actually rose, and they were driven by increases in rural areas and in the poorer states of the country. These findings identify feasible tasks to achieve the SDGs in India. For example, the government can add newer vaccines against pneumonia and diarrhea, expand measles vaccine coverage, including consideration of elimination of measles deaths, and improve the treatment coverage for malaria, particularly in hotspot districts. Specific attention to babies born with low birth weight is also required to reduce neonatal mortality. So let's sum up what we've learned in this section. First, the Sustainable Development Goals for health rely very much on reductions in cause-specific mortality. Second, to achieve the Sustainable Development Goals, reliable and direct mortality data are needed. Third, model data are not as accurate as direct data, especially at the national level. But model data and direct data can work together to improve estimates, particularly at the global level.